So you just had a CO2 or erbium or any ablative fractional laser, and even though your provider prepared you for the copious amount of downtime, you're still Googling at 2 a.m., is there a way to speed up recovery? Well, you're not alone. Today, I'm walking you through exactly how to speed up healing after a CO2 laser, what products to avoid, what products are actually going to help you speed up recovery, and of course, when are you going to start to see those results that everybody brags about on Instagram? And spoiler alert, it's not going to be tomorrow. My name's Tara, and I'm a 43-year-old medical esthetician with over 18 years of experience practicing with lasers and medical devices and medical skincare, and I'm here to teach you all the things about skin anatomy and all the devices on the market. To put it short and sweet, CO2 and erbium lasers are ablative, meaning that they vaporize the upper part of your skin, which is called the epidermis, and also the dermis, depending on the settings. And what this does, this controlled wound, signals to the body to regenerate itself, and thus making more elastin fibers, and of course, collagen. Collagen is such a buzzword, isn't it? I mean, I feel like you go anywhere these days and products at Sephora, at your grocery store, on podcasts, they all want to say that they stimulate collagen. But the reality is, as a medical esthetician and learning these things in the industry, if people knew what skincare products were actually penetrating the stratum corneum, I don't think it would be a billion-dollar industry that it is now. But with lasers, we have hundreds, if not thousands, of studies now in PubMed that prove their efficacy in regenerating both collagen and elastin fibers in the dermis. And so this controlled injury, biologically speaking, if your immune system is strong, you're going to regenerate and get the results that everybody talks about. But, when you have family members or friends that are constantly criticizing you, like, why would you pay for that? Why would you burn your face off? You can tell them, look, after 25 years old or 28, you lose 1% of collagen naturally every single year that you get older. So for me, right, I'm 43, I've lost 25% of my collagen already. So I know that I do energy-based devices or, chemical peels or other ways of exfoliating every 3 months. And it's important to me because I want to look my best at 43. That's why the healing process is such a big deal. It's where the magic actually happens, but only if you do it right. Now, it's likely that you're watching this video while you're in the inflammatory stage. There's 3 phases of healing, the first of which is called the inflammatory stage. You are red, you are swollen, it's oozing, it's a lot of work. It's even sometimes sore or painful or really hard to sleep. And that can last anywhere from day 1 all the way till day 6. So once you get out of the inflammatory stage, you move into the proliferative stage. And that is where a lot of the redness and swelling starts to kind of move down the scale. However, you're going to see broken blood vessels. You might see some breakouts. Things are happening on a cellular level. You're creating new blood vessels. So all these things are happening, and you're still seeing some of that light inflammation, but not to that degree. And then you move into the last phase, which is the maturation phase or the regeneration stage. That's where your body is actually manufacturing and making new cells. Now, hopefully your provider went through all the necessary aftercare steps with you, but in reality, most of us are cleansing and applying the balm and rinse and repeating that for a week. And you're going to be doing this like every 3, maybe 4 hours. You absolutely want to keep it moist. You want to keep it hydrated. You do not want any scabs. So that is why occlusive barriers are so important. I remember when I did this, I had the erbium done, a very aggressive erbium for my acne scars. So it was like all through here and on the other side. I'll insert a picture somewhere here for you guys, but it felt I dreaded cleansing because I was worried about the stinging, but in all reality, when I started to cleanse and I finished and I put that balm on or that occlusive barrier, it was so comfortable. Now, I use the Elta MD laser balm. That's a really good one too. I don't believe that one is non-comedogenic though. So I did get some breakouts as I was recovering. Okay, so let's get into some actionable tips for you guys. How can I speed up healing after a CO2 laser? These are the things that I've learned over 18 years of performing CO2s and erbiums on how to actually speed up the recovery, but more importantly, how not to make it worse. Step 1, occlusion is life, you guys. Occlusion is a fancy way of saying like a thick ointment. So think Vaseline, Aquaphor, Elta MD laser balm, anything like that. But the trick with the occlusives and the way that I've kind of figured out which one works better is actually the white petrolatum, which is commonly known as Vaseline. And the reason why I like that one sometimes better than some of the other brands is because it's non-comedogenic. And if you kind of think thick balm, if you're acneic, you're breaking out from that. And sometimes if people have had their eyes done with laser, they're putting the balm near their lash line, which is clogging up their oil ducts, and that can cause a sty. So the balms are super, super important, but you want to go with something that's non-comedogenic. Step 2, and this is not in any order, this is completely random, but hypochlorous acid. Not to be mistaken with hydrochloric acid. This is very, very important. Hydrochloric acid can do a lot of damage, so please don't confuse the two. Think Magic Molecule. I mean, there's so many brands of hypochlorous acid on the market today, some better than others. I prefer LaserSyn or Levicin. Those are a game changer, not only to prevent against infection, because like I said, infection is the #1 risk associated with lasers, but also the healing benefit of hypochlorous acid. The formulation I use that I love is a pharmaceutical grade, so you do need a medical license to purchase it. However, prevents against all microbial, like bacterial infections, including staph. It prevents against all fungal infections. It's wonderful. So I have everybody using this. They're spraying instead of using the vinegar soaks. It's not smelly like the vinegar can be. And I think it has a better anti-itch formulation in it. So, you know, as you're healing, you might feel kind of tings of severe itching. It's pruritus. And, you know, people will generally use like a steroid cream like cortisone 1% over the counter, or you can use this hypochlorous acid. And I do think that helps a lot with the itching, the stinging, the burning, all the things. Step 3 is to stay inside. You guys probably already know this, but expect to kind of prepare for these treatments when you get these done. Expect that recovery time. That first week, your skin is really trying to heal, and any kind of UV radiation is gonna delay that healing mechanism. And also, if you are more Mediterranean or you have that olivey skin type and you had a fractionated CO2, for instance, you are going to be more at risk for PIH, post-inflammatory hyperpigmentation. So it's even more important for you to stay out of the sun. Step 4 is going to be red light therapy. We all know about red light at this point. I mean, I'm constantly marketed on my feed day in, day out about all these masks and stuff. So is red light legit? Absolutely it is. Is it the be all end all of, like, you know, age defying treatments? No. So red light specifically is for inflammation. It's for chronic inflammation, any type of injury red light is really wonderful for. In fact, I follow on YouTube, I think her name is like, where is it? Oh, Lab Muffin Beauty Science. If you guys have not watched her channel, definitely check out the video. I'll link it somewhere above here that she did on red light therapy. And there's a lot of different opinions, but I know the science. Every conference I go to, every industry meeting that I go to, the science is presented, and red light therapy is legitimately helpful. Low levels of red light. If you can find a mask that has both the 600 nanometer and the 800 nanometer wavelengths in it, you want 2 of them. And then the other thing is, like, there's some of like the dome shapes that you can put over your head. But they are kind of finding that the light has to penetrate through the skin. So you want it as close to the skin as humanly possible. So those masks, that kind of Velcro, I know Omnilux has one. I'm not sure if it has the 600 and the 800 nanometers in it, but definitely check out her video because she deep dives into the science behind red light therapy. But it absolutely has helped cut the time in half when people are using the red light for 30 minutes a day or twice a day if you would rather do that. I think it really does help. Step 5 has got to be one of my favorite things of all time, water masks. Now, This is something a little bit newer on my side of the industry anyway. We've always had like biocellulose masks. I know is it SkinCeuticals? I think it's SkinCeuticals has a biocellulose mask that I've been using, on my patients forever, which is really nice. It's nice and cooling, but Velege, however you want to say it, it's a company I think that originated from Germany. They sell a very thick, luxurious silicone mask. And it is sterile, so the second you put it on the skin after the treatment in the office is what I like to do. It cools the skin immediately. And so it's taking a lot of that inflammation out right away. I just love these so much, and they've been such a game changer. Every patient of mine since I started doing this, pretty methodically now, has raved about the downtime. So I'm very happy and pleased to say that it makes such a big difference. If you don't have any masks at home right now, it's okay. Just use a clean hand towel and make sure it's in cold water, and use it as a cold compress instead of ice, and just let that sit on the skin for like 15-20 minutes until it starts to kind of get warm, and then repeat that every few hours. Step 6, stay hydrated. If you're like me or some of my patients, when you know that you have to stay indoors, Netflix and chill, and you really can't do a whole lot of anything, maybe clean out your closet, you're going to be tempted to have some wine, or maybe a cocktail, or maybe this or that, which I'm not telling you not to, right? You do you. Whatever makes you happy, especially when you're going through this process, do it. But it's important to know that hydration is key to recovery. So if you're having any alcohol, this can definitely impact the recovery to some degree. So just keep that in the back of your mind. So some of you watching are probably thinking like, well, she hasn't mentioned exosomes. Why hasn't she talked about exosomes? And then the other people watching right now are like, what the heck is an exosome? And I'll explain here. Exosomes are the new science that we have in regenerative medicine, still very new, that is basically showing us that there are molecules in stem cells, and these molecules can talk to other cells, and they either tell that cell to regenerate or degrade. And so what some of these companies have done is they have selected the molecules that tell the body to regenerate, and thus kind of making it a better option for people that want to heal faster. So topically speaking, I personally have used 2 exosomes. I've used Benev fat-derived exosomes, and then I have used blood platelet-derived exosomes for 3 years now. I will tell you that my experience using both for recovery for CO2 has kind of been a toss-up. Some people do really well, and then some people, they could take it or leave it. So they are very, very expensive. Is it worth the price to purchase exosomes? Maybe, but also maybe not. So that's just been my experience. So some people do well, some people don't do as well. The other bonus tip that I have for you guys is Nectar by Elastin. It's a peptide. Now I have seen this one do actually very well, and a lot of people love it. It's kind of more of a silicone-y feel when you put it on your skin. It's not as maybe soothing as like some of the ointments are. So I would say if you're still in that, first 3 to 6 days of recovery, stick with the balm. But then once you graduate into the proliferative stage where your skin is healing and you can start using a lotion or a moisturizer, I would incorporate the Elastin Nectar. I think that would really help. I should also add, I have no affiliation with any of these companies. All right, now let's talk about products. Let's get specific. Let's talk about brand names. So let's get into the products that you can and should be using. The first of which, barrier cream. What are the brands? Well, we know there's Aquaphor, Vaseline, Cyclophate by Aven. There is also CeraVe. Those are all well and fine, but if we go back to what I mentioned earlier about something that's non-comedogenic, that's gonna be something that you're gonna wanna look for on the label. If you guys have seen this, any type of thermal spring water, Aven has a really good one that I love to use. Sunscreens are very important, and the brands that I prefer to use is Color Science. Love Color Science. They are specifically formulated for post-procedure. Elta MD, my favorite one by them. They actually just came out with a new one. I'll put it somewhere on the screen here, but it's actually green to offset the redness in your skin. So I've tried that a little bit. I really like that one. But my favorite of all time by them is their Elta MD Facial Clear, but it's tinted, if that makes sense. You want a physical block. And what do I mean by that? When you turn over the ingredient list, you don't want the chemical block ingredients in there, or not as much of them in there. That can just, irritate the skin a little bit more, especially again when you're compromised. Even better, wear a wide brim hat. If you're gonna walk the dog, if you're gonna just go for a nice leisurely walk, a wide brim hat is the way to go, especially on day 1, day 2, day 3 when you can't put a sunscreen on. Aside from tinted sunscreen, what can you use to conceal? Well, like I said earlier, Oxygenetics is such a great brand. The only hurdle that I'm going to tell you right now, because everybody runs into this problem, is finding the right shade for your skin type. The second best or runner-up is a more economical, affordable version, Clinique Beyond Perfecting. I used that a lot when I was recovering last year from my CO2. So now let's talk about what you should definitely avoid. The number one thing is going to be fragrance and essential oils. People don't even realize how much they're using essential oils around the house, but if you touch, some scented candle or something and then you touch your skin, that can absolutely burn and you can cause some more irritation on top of irritation. So any type of fragrances in your products, perfume, if you're spraying any type of perfume, just be very, very careful of fragrance. Common sense, but anything with retinoids in it, retinol palmitate, anything that you're like, oh, you know what? This is my favorite product. I'm sure it'll be okay. Just don't do that. Literally just use what your provider gave you or the things that I'm giving you today. Even though something seems harmless, I can't tell you how many times somebody has had a bad reaction or contact dermatitis because they use something that ordinarily works very well for their skin. Chemical sunscreens. Now this is a difficult one because chemical sunscreens are everywhere. So even when products are touted as, all mineral sunscreen or, all physical block, when I turn the ingredient list and I look at that, usually it contains one ingredient that's a chemical block. So I would just be, instead of wasting all that time looking at everything, just use Elta MD or Isden. The pure zinc sunscreens are ideal. The next section deserves honorable mention because even though your provider probably already went over this with you, it bears repeating. And like I said before, the number one risk or side effect is infection. So within that first 72 hours after a laser treatment, you want to be on the lookout for things like feeling under the weather or not feeling like yourself or coming down with a temperature of 100 degrees or higher. Reach out to your provider and make sure they're aware. The sooner, the better. Any cyst or large nodule formation on the skin that was lasered. They look like cystic acne breakouts, and sometimes they can get a little larger than that, and they're very painful to the touch. They feel like there's a lot of pressure. Absolutely reach out as soon as you see maybe 1 or even 2 of these start to appear. Can they be a breakout from the occlusive barrier? Yes, I've seen that before too, but it's always best to err on the side of caution. There's a statistic that I recently heard that 92% of us have the cold sore virus in our systems. It's just a lot of us don't know it because it's dormant and it hasn't come out yet. But those of us that have active ones, we're very aware, and you always have to be on an antiviral 2 days prior, and you keep taking the medication until you're fully healed. And lastly, PIH, post-inflammatory hyperpigmentation. Those of you that are more Mediterranean skinned or olivey skinned are going to have this inherent side effect in your skin cells. Anytime there's heat on your skin cells are going to overreact and produce more pigment. Now, it's not the end of the world. Even in lighter skin patients, they can also get the same thing, but it's called post-inflammatory erythema, which is more redness than usual. It always goes away. It's just a lot of people don't want to wait months and months for that to resolve. So we use topical, lighteners and brighteners that will help nip it in the bud. My favorite compound from a pharmacy is like a kojic acid, it's got arbutase, a little hydroquinone in there, but it does such a great job at eliminating that PIH and making sure it stays gone. Move into the last section today, which is going to be how long after CO2 laser will I see results? This is the $1 million question for everybody, because let's say you're on day 3 and you're like, how much longer? But it just depends on the settings. You know, if you're in your 60s and the provider that you had was treating your lip lines or a little bit of laxity, then yeah, expect to kind of be in this recovery mode for 2 weeks. If you had lighter settings and I don't know, let's say you were treating some acne scars or something like that and you had a fractionated CO2, then expect about a week. After that, after 2 weeks or after a week, you're still gonna have some redness and pinkness to the skin, but that's completely normal, you guys. If you see that on month 1 or month 2, just know, take it from me, that is a sign of construction. On a cellular level, you want redness because that means that all the good things are coming into play. So you really have to give this time. When I see patients for a follow-up, I usually have them come back like anywhere from 3 months to maybe 6 months, and then we can really start to see their final results, and that's the exciting time. The first thing that you're gonna really start to notice is that like a lot of the pigment and the reds and browns are all just clear. After you've kind of healed, you see this new skin peeking through and it just looks bright and glowy and gorgeous. But when it comes to texture, like fine lines, and when it comes to laxity and things like that, you're really not gonna see your outcome for a few months. So just be prepared. Now, let's say we're getting into month 3 and month 6. That's when CO2 really shines. Your skin rebuilds over time, it's not overnight. So it's a marathon, it's not a Sephora sale. And then secondarily to that, when it comes to your results, really those results last for years. They can, as long as you're really good about your sunscreens, your retinols, your active ingredients to kind of almost lengthen those results for you, you will get so much out of that one experience. Now, if you're sitting there watching me all red-faced and swollen, and you're thinking, oh, I made a mistake, don't, okay? This is only temporary. I am here to help. This is just the healing phase. It's natural. It is supposed to occur. You will get through this. And quite frankly, there's so much going on underneath your skin, right? There's collagen production happening, elastin. This will be worth it, not only for the nice improvements, but how long your improvements will last. Make sure to always follow your provider's protocol and stay patient, and definitely don't compare your recovery to somebody on Instagram's filtered recovery, because quite frankly, you don't know what settings that were used on them, and it could be very, very different. You know, if you're going through this right now, or if you're one that's very curious about this process and you have any questions that pop into your head, make sure to leave a comment down below, because again, I've been doing this for a long time and I most likely will have an answer for you. And if I don't, I will find an answer for you. Comment below if you are currently recovering and maybe doing a little panicking, and also like and share with your friends maybe that are about to book a CO2 appointment and they might not know about the recovery process. Thanks, and I'll see you next time.